I am currently, over the next 11 days, working in Ohio, and I just got here, and it's kind of crazy to be out of campaign mode, but I thank you guys for letting me be out of campaign mode for a little bit. But my real life, my real job is in San Francisco, and I work for a couple different tech startups, actually. And it's interesting how I got there, but there's a story connecting it to global health. I mean, probably the least traditional person up here in relation to global health minor, but I was a part of the inaugural class that went to South Africa in 2005, a long time ago, and then went on to France right after that, back to back, also part of the global health program. And for me, I mean, my whole life is kind of an entrepreneurial life, so what I do is look for opportunities and things that interest me and then glue onto them. And so I was here at Northwestern taking a lot of classes, come from a very kind of politically oriented family, active family. It was a political science major, but heard about this program and realized I didn't know anything about HIV/AIDS, and I had heard so much about it. I knew it was a big problem. I felt a little guilty for not knowing more about it. So I thought, well, what a great experience to go abroad and get experience to learn about this in depth and get to go to a country I've always been interested and fascinated by. So that I wanted to have that global perspective that was really important to me, but I didn't want to just go abroad and just not really have a focus or just live in a country. I wanted to learn something while I was doing that. So the Global Health Program gave me a lens, international focused lens that I really appreciated, and it made me realize through the process how important policy was and how much changes when different governments come in and out in whether it be a developed country or developing country. So for me, that kind of fueled my general interest in political science and policy world. And I also, in France, remember just comparing all these different European programs in healthcare, and then looking back at the United States. And at the same time, my aunt and uncle had just gone through their second bankruptcy because my uncle was self-employed and had a heart attack, probably 2 heart attacks, and couldn't work anymore, and he didn't have healthcare. And they lived 2 hours in the Canadian border in Washington State. And I always thought, well, if they lived 2.5 hours north, they'd be Canadian and be fine. Like, that's crazy. And so for me, that really fueled my activist side that comes from my parents, and I really want to get involved. I got involved in the first Obama campaign and felt that was a way to get at a federal level to what is now the Affordable Health Care Act, and that was really important to me. So I worked through there, and then I fell into the tech world because out of that organizing work that I did, we wanted to build tools that made organizing a lot better. So that's what I'm doing now. And actually, global health came back at me because one of the companies I'm working with, NationalField, we had a contract with the National Health Service in England, where I had studied in France, and I got a chance to go to England, live there for a year, work with all the nurses and the administrators that were there to build their internal social network. And it was really interesting to have that knowledge that I was like, oh yeah, I had this minor that I learned about you guys 7 years ago, and it did really come in handy. So, you know, all of my life kind of, one event leads me to another, and this event started me off to kind of where I am now.